Okay. Good morning, everybody. It's an honor for me to be here in front of this amazing audience from the other part of the world. Um, Dr. Ricardo Sandoval. I'm a general physician, a clinical epidemiologist, and also a specialist in aesthetic medicine from Colombia. And I'm a global speaker from Nubia. And today I'm gonna talk about some important things. We are gonna talk about trends, the trending topics of aesthetic medicine, dermatology, and plastic surgery. Which are these trends? Collagen biostimulation, obviously combining therapies, and regenerative medicine. So first, to start, I'm gonna start talking about a concept that we all are trying to achieve in our patients. And this concept is synergy. We are trying every time to combine therapies to gain more, but without causing a higher risk for the patient. But what really are we looking for? We are looking for volume, for structure, lifting, but these new terms that came into account in our clinical practice, redensification, regeneration of a tissue, also hydration, but another term that is really important, prevention, because now we are thinking in our patient in the moment that we are performing our procedures, but we are thinking about how it's gonna be 20 years later. And the problem is that we have a lot of protocols, a lot of products and technologies, and maybe we can get lost in the process to give the best results to a patient. So first, I'm gonna start asking you doctors, why did you choose your fillers or your energy-based devices that are used in your clinics? If I make a survey, maybe a percent of the doctors will say performance, because we all know that this is important for us, but it's really important for our patients. They are looking for natural results and long-lasting results. They are trying to obtain with one syringe of a filler magic, and we all know that maybe that's not even possible, but we can perform some procedures to help to the patients to obtain what they want. But let me ask you another question, and is what is the cost of a complication in our medical practice? That's why the bigger percent of doctors will say that they choose their products because of thinking about safety. We are thinking about what is going to happen with our patient, and that's why we are here. We are here learning about managing of complications and to try to understand what is going to be the best for our patients. So let's go to the basics. Let's just think in that syringe, that simple syringe that is a hyaluronic acid filler. Why? Because it's one of the most popular procedures all around the world. But now we know that there are some things that are happening. So let's think what is inside this syringe. We're gonna have water, we're gonna have hyaluronic acid, but also if we wanna inject this product not as a liquid one, but as a gel, we are gonna need the cross-linker. And now we know that the cross-linker is related with immune response in the tissue. So that's why all this pharmaceutical industry is trying to reduce to the less point the most popular one cross-linker that we are using, that is the BDDE. But let me tell you something. What if we can have zero BDDE? And in this case, we obviously are gonna need another cross-linker. So let me introduce to you PEG, PEG, or polyethylene glycol diglycidyl ether. PEG is one of the most common molecules in medicine. It has studies from all around the world since 30 years ago because it has been combined with different drugs, and now we also have information about the combination of PEG with hyaluronic acid. There's also comparisons about how the crosslinkers can work in the tissue. And now we know that PEG is 30 times less toxic than BDDE. So this is good. But what happens when we combine with hyaluronic acid? The studies have been showing less and inflammations, like a local anti-inflammatory response and a regulation of the immune system. So this is really good. But now let me take you to the worst scenario. What happened with these patients that has an underlying condition that we don't know that they have, and that these conditions are related with the most adverse events? What group of patients could be that? The patients suffering from autoimmune diseases. Let's think in one that we used to work with the patients, and we used to inject this group of patients all around our clinics. Hypothyroidism, but caused by Hashimoto. This is a very large group of patients, and there are a lot of publications related with complications in these patients. So that's why in 2023, this study was released to the world, trying to understand what happened when we inject a filler, a pegylated filler, the one that we are talking about, in half of the face, one syringe. And the follow-up was doing by biopsies and also blood tests. What were the results of this study? All the lines related with the response to a foreign body were reduced in the tissues in the following biopsies. What happens? The antigen recognition, the antigen presentation, and also cells related with giant cells and the formation of granuloma were reduced in the tissue. Also, the B lymphocytes were reduced too. So this is important to not produce or generate antibodies and second response when we are injecting fillers. So all this inflammatory infiltration was reduced in a big percent. And what happened in the systemic blood test? No reactivation of this autoimmune condition was presented in the patients. So this is a safe option. Now we just have this kind of information just for hypothyroidism with Hashimoto. But there are a lot of studies that has been working right now, trying to understand what happened in another different autoimmune diseases. But beside that, what else can happen in the tissue when we inject the pegylated filler? Let's go to the chemical structure. When we compare the chemical structure of this crosslinker, we know that even the shorter version of this polyethylene glycol is 3 times longer than the BDDE. So we are gonna have the chains of hyaluronic acid in more separate, in a different distance. So that's allowed in physics to more resistant to the forces and vectors of the filler that is gonna be forcing in the face of the patient. So these fillers, they introduce in long-lasting results. And another important thing is that the results are gonna maintain more in the time, like not having this Cinderella effect that most of the fillers with BDD can have at some point when we have it on our faces. Another important thing about PEG is that it helps to the filler to have more concentration of hyaluronic acid. So now we are gonna have the highest concentration hyaluronic acid fillers, cross-linked fillers, with 28 nanograms per deciliter, with a well-balanced rheological properties, thinking about cohesivity as the main character. So here we have some options. We have the intense line. These products are gonna help us to generate voluminization, structure, and also hydration. And for me, those fillers are also called hybrids because they combine glycine and L-proline, which are part of the change and structure of the collagen. But let's think in something else? We know that now we wanna try, we wanna approach to the aging process of the face, working in all the layers. And skin is really important. We know that all skin are gonna have different changes. We are gonna have senescent fibroblast. We're gonna have less collagen. We're gonna have less elastin. So let's work in this area if we wanna prevent the aging process. So that's why everybody is trying right now to look for collagen biostimulation. Like, I don't know if here Lindsay Lohan is famous as in America, but everybody is asking what kind of treatments has performed Lindsay Lohan, because she has now a more natural result and the skin and her skin quality is better and better. So yeah, we want to produce collagen, but what kind of collagen we want to produce? We want to go from this way in the production of collagen, because there are collagen here. There's a lot of collagen here, but it's a pathological production of collagen. I think we prefer that. We prefer the physiological production of collagen. This is the key of the regenerative medicine. So let's combine these pegylated fillers with a collagen biostimulator with calcium hydroxyapatite. And that's why in 2012, Stimulate was released to the world. Stimulate is a hybrid that contains calcium hydroxyapatite, glycine, L-proline, and also PEG. There's another version of Stimulate that is Hydro Deluxe that is not combined with PEG, but it also has calcium hydroxyapatite in the way to be applied in a more superficial way in the skin. So here we have this CAHA molecule. This sphere is completely smooth, but it must have some characteristics if we want to stay in the safest treatments. In the safety for the patients, for us, we need to combine this molecule in a different way. So first, we're going to have a lower concentration. Why? Because we want to inject this molecule in all of the areas of the face. We want to inject it more superficial. We want to inject it on the skin. We want to go down the skin. So we need concentrations that will help us to work in a versatile way. There's also something really important, and is to have the smaller molecule in the world, and it's around 5.42 micrometers. And also that these molecules are going to be surrounded by a cluster, by an HA plus PEG, the pegylated filler. So we are going to be having this biostimulation effect during 1 year or more in a physiological way. What the studies has been shown, that if we have these spherical, extremely small and smooth particles in the tissue, we're going to prevent the migration of giant cells to this area of injection, so we are not going to produce or generate granuloma. That's why with Stimulate, the possibility to generate granuloma is almost zero. In the other way, we can achieve production of collagen and improve and enhance the balance between old collagen and new collagen. We are going to be able to enhance the degradation of this damaged collagen, and we are going to be able to enhance the production of new collagen. And this has been shown in 3 months after the injection. There are another studies with more time, 8 months, that has shown a perfect integration of the filler with collagen production. But this picture is really important for me and for everybody, because that's a fibroblast ready to produce new collagen, like the collagen biostimulation stimulator was applied like 3 weeks ago. So this prove and confirm this prolonged liberation of biostimulator during the months of application. In the clinical experience, we see the same thing. We can see that our patients with just one treatment of Stimulate can maintain the results during the years. This is a follow-up of 2 years. The improvement in the skin quality is gonna maintain through the time. What is the term for that? Prevention. We are trying to prevent this aging process in our patients. So we are giving more things. But we want more. We always want more. And what we want? We want to combine with all the devices that we have in our clinics. But what happens if we combine a filler with VDDE with these technologies that we have, energy-based devices? The evidence has shown that the rheological properties of these fillers can be damaged, can be reduced, and we are going to be losing the benefits of one of the treatments that we are performing. And that's bad because we are looking for synergy. We are looking to improve the results of each of the treatments. So let me tell you something. The pegylated fillers can resist greater heat, greater amounts of heat. This is a property that is called thermostability, and is just a property that the pegylated fillers had. These fillers can resist to 70 degrees temperature without causing any damage or alteration to the rheological properties of the filler. But what this is important, because some of you can say like, well, I perform first the devices and then the fillers. But now we know that when we perform a treatment with a device, the tissue and the quality of the tissue is extremely important if we're looking to enhance the results. So you can think, if we have this hydrated skin with more water, with more young fibroblast, we're gonna have this regeneration effect, we're gonna have the resistance to heat, and we are gonna improve something in the tissue, water. We're gonna have more water. And what is water for the tissue? A chromophore. Water is the best chromophore for most of the technologies that you have on your own clinics. And that's the principle of this smart combination therapy. The smart combination therapy will help us to produce synergy without causing any damage of the tissues. Which therapies we can combine? Let's see all these type of therapies, laser, HIFU, RF. But the thing with these three is that in some point they can cause a damage of the tissue, so it will force the tissue to make a healing process. But the last one, which has become one of my favorites, just produce a contraction of the collagen without causing damage of the tissue. That's why Zafiro is one of the devices that is the favorite one on my clinic. Zafiro is an infrared, a near-infrared energy device that can produce solubilization of collagen. That for me is really important, because here is when the physiological production of collagen happens. When you are not causing any damage to the tissue, but you are sending signals to the fibroblasts to produce collagen in a slow way, in a more physiological way. Zafiro by itself can produce increasing the dermis thickness in a 40%, can increase the migration of fibroblasts in a 40%, 21 days after the injection and after the performance of the procedure, can produce angiogenesis, can enhance the elasticity of the skin. And that's why when we are performing this kind of treatments in Latin America, every patient is feeling really well since the first session. They are reducing the skin sagginess and also obtaining this glow effect that everybody is looking right now as another trend in the global market. Another important thing is that we can use Zafiro for the patients that has this severe photoaging damage, because as this procedure is not gonna wound to the heel, is not gonna hurt the tissue, we are gonna get the results, but we are gonna get really good results. And in my experience, also these patients gets really happy with the outcomes of the procedures. Also, we are not gonna reduce the amount of adipose tissue to the patients, because we don't wanna lose the support and structure of the face, but because we know that it is really important in the aging process. But now let's combine Zafiro with the fillers. And that's why we have the Enleaf protocol. The Enleaf protocol brings to the market the combination of fillers at the same time that we are performing an energy-based device. This is the study that combines the not reticulated with the reticulated fillers and also with Zafiro, the infrared technology. It is performed in the first session, 7 days before the performance of Zafiro. First, we inject this product that is Hydro Deluxe, that is a non-reticulated filler with calcium hydroxyapatite, so we can improve the ability of the tissue to increase the amount of water. And 7 days later, we can go with the other fillers, the intense line, the stimulate line, and we can perform Zafiro. And what are gonna be the results when we combine these technologies? We are gonna improve everything. We are gonna improve efficacy. We are gonna improve the migration of fibroblasts even more, even like 2.5 comparing just with Zafiro. We're gonna improve skin elasticity, skin hydration, skin angiogenesis, but we are gonna control the inflammation of the tissue. We are not gonna cause any damage of the tissue. That's what we can call synergy. And that was why I decided to create this technique or this system that is called the Smart Dual System, which is an approach of 5 stages, going from the deep to the superficial, trying to combine the fillers in the better way, using less fillers, but combining with energy-based devices. And these are the results that I get. I'm gonna tell you the amount of syringe in some of the cases. This first case, I use first 1 syringe of intense, then 1 syringe of stimulate in the same session. Then I perform the Enleaf, that is Hydro Deluxe, and then Zafiro. And this patient obtained these results. She was really happy because she reduced the sagginess of the skin, she improves hair contour, and she also reduced some of the symptoms of one of her conditions, that was rosacea. On the other hand, we can have these patients, the male patients, that are always looking for natural results, but here I use intense, stimulate, and also the Enleaf protocol with Hydro Deluxe and Zafiro to obtain this kind of lifting effect that is really natural for the patient and the improvement on the skin quality that he was looking for. This patient, I just performed the Enleaf protocol, Hydro Deluxe with Zafiro, 3 sessions, and this was the result. She just wanna look better. She was wanna look more defined, less sagginess. This case I present in Monaco in the AMWC, and here I just used 2 stimulate syringe and Zafiro. I try to combine technologies, but I try to make my own protocols. And here, with just 1 session of Zafiro and stimulate 6 months later, we can see the results on our patients. We can see the improvement on the quality of the skin. With this patient, she used to work out a lot, so she is losing in a lot of weight. And I just performed the Enleaf protocol, and I see result in the improvement of the skin quality, and she was really happy because this is a natural result for her. This case is also important too, because we can have also acne scars in our patients, and we want to improve the quality of the skin. Here I use a stimulate and Hydro Deluxe in a sandwich technique, and then 2 sessions of Zafiro. And he achieved better results than the other procedures that he performed years before with collagen biostimulators. His skin was better, and this is Vectra, so we cannot fix any of the pictures. And here, these last 3 patients, they all were looking to improve his face definition, to her profile, their profile. So I perform here a stimulate Intense, and Zafiro. And I achieved a really good result in this patient. With this patient, just the N-Leaf protocol, which was Hydro Deluxe and Zafiro. She improved a lot the hair quality of the skin, and the same thing with this last patient. She just have for Hydrolux and Zafiro, she has not enough money to perform another procedure. So I decided to perform Zafiro, and she was really happy because she reduced sagginess, she improved skin elasticity, she also improved her face contour, and also gain a lot of self-esteem, which is also important. And that's remember that is important to us, because even though if the patient can pay or allows a lot of procedures, with less we can give more. So now we're gonna go with Dr. Joe, which is gonna talk about another technology that I really like, which is laser me. So Dr. Joe, a pleasure.
Thank you. Can I get a pointer? Right. First of all, welcome everyone for the IMCAS Asia in Thailand. We have many friends from many countries joining us today. So let me try to say hello. สวัสดีครับ Magadan Hapon, Salamat Pagi, and in Indonesia. Ohayo gozaimasu. Annyeonghaseyo. If I forgot any language, your language, please drop by to teach me after the session. And hola, hola. And of course, thank you, Dr. Ricardo, my friend, for the enlightening discussions about advanced strategies for multimodality approach. Building upon the foundation he has made, I would like to continue our explorations into treatments that not only focus on rejuvenation, but also address specific concerns such as acne scars. I have developed a method I call N-Glow that supports the skin natural renewal process, aiming for a balanced and healthy glow. Let's dive into the potential this treatment offers and how it might add value to our practice. Let's start with the glowing skin. What does glowing skin really mean? For most, it means quiet confidence, shining from within. It's natural beauty that reflects balance, care, and radiance without any effort. But it's more than just looking good. According to aesthetic doctors, glowing skin is healthy, hydrated, even toned. It shows optimal skin function free from dullness and inflammation. A true natural glow because of balanced care inside and out. N-Glow. I combined Novia Hydro Deluxe with Laser Me for a dual approach to skin enhancement. Let's recap what Hydro Deluxe is. Hydro Deluxe is a non-cross-link HA filler enriched with 0.01% calcium hydroxyapatite and amino acids. This combination supports both immediate hydration and long-term collagen stimulation. Non-cross-link HA, like in Novia Hydro Deluxe, offers hydration without adding volume, while cross-link HA provides structural support. This allows us to tailor treatments based on whether the goal is hydration or volume enhancement. Injected HA attracts water, providing hydration. By adding calcium hydroxyapatite, it's not only stimulates collagen production, but it's also strengthened epidermal differentiation. Oops. HA is a linear polysaccharide that is composed of repeating disaccharide unit of D-glucuronic acid and N-acetyl D-glucosamide linked by beta-1,3 and beta-1,4 glycosidic bond that provide viscoelasticity to the dermis, fascia, and most fluid media. These are all Novia filler ranges available in Thailand. Each is tailored to the patient's specific need. And all Novia filler use smart cross-linking technology to enhance filler stability and durability, maintaining long-lasting effects without compromising tissue quality. HydroDeluxe focuses purely on hydration, formulated with amino acid for enhanced stability, but without cross-linking. The benefits of amino acids are increased safety due to non-cytotoxicity, extended duration by slowing enzymatic breakdown, and complete biodegradability. This makes HydroDeluxe both effective and safe for long-term use. Glycine and L-pauline are two essential amino acids found in Novia, like Dr. Ricardo said before. And they are the keys to collagen production because 70% of collagen is made of glycine, proline, and hydroxyproline. These ingredients are not only improve moisture retention, but it also helps skin heal and rejuvenate, making results smoother and more natural in the long term. Dr. Martina has done a study about viscoelastic property and thermodynamic balance improvement of HA, enriched with glycine and L-pauline. The study showed that glycine play an important role in controlling cell volume, osmoregulation, and preventing hydrogel swelling. The addition of glycine and proline provide hydration and softness to the tissue. These factors stabilize the hydrogel structure, both viscoelastic property and thermodynamic balance. Next is CAHA, or calcium hydroxyapatite. CAHA in HydroDeluxe is designed with small, rounded particles for stability. These particles cluster together, and their uniform distribution provides a natural improvement in skin texture and elasticity. Let's address the specific concern for today, acne scars. Acne vulgaris has a prevalence of over 90% among adolescents, and we all know that it has a significant psychosocial impact. All body areas with high concentrations of pilosebaceous gland are affected, such as the face, the chest, the upper arms, and the back. P-acne stimulates keratinocyte, monocyte, and sebocyte to TLR, CD1, and CD14. TLR receptors are on the surface of macrophages, which are some of many pathogenesis factors that cause acne. They release many cytokines and stimulate the infra-infundibular inflammatory process, perifollicular rupture, and perifollicular abscess formation. This can lead to the wound healing process. The wound healing process has 3 stages: inflammation, granulation tissue formation, and matrix remodeling. First, the inflammation. For this stage, the vasodilatation and the melanogenesis play an important role in the development of PIE and PIH. Second, the granulation tissue formation. This stage repairs damaged tissue. In the beginning, type 3 collagen makes up around 70 to 80% of collagen production. Over time, they shift toward type 1 collagen, similar to minimal on normal skin. This can lead to minimal or no scarring in some individuals. And third, the matrix remodeling. It is the balance between MMP and tissue inhibitors of MMP. MMP stands for matrix metalloproteinase. If the balance can lead to poor collagen production, resulting in atrophic scars. If the healing process is too excessive, it can cause the formation of hypertrophic scars. We have many types of acne scars, but today we will focus specifically on atrophic scars, which are rolling scars, ice pick scars, and box scars. Rolling scars occur from dermal tattling and are usually wider than 4 to 5 millimeters. Abnormal fibers, you see here, that anchor the dermis to the subcutis, leading to superficial shadowing and a rolling appearance to the overlying skin. Box scars are thinner than 2 millimeters, sharply marginated and deep. Furthermore, there are the epithelial tracts that extend vertically to the deep dermis, and sometimes you can find that it can extend to the subcutaneous tissue. And box scars are either round or oval depression with sharply demarcated vertical edges. They are clinically wider at the surface than ice pick scars and do not taper to a point at the base. Here are some uncommon types of acne scars: linear scars, bridging scars, and papular scars. There are many treatment options for acne scars: TCA cross, fractional laser treatments, dermabrasions and subcision, punch elevation, dermal grafting, microneedling, surgical excisions, and dermal fillers. Dr. Sabina and her teams explored the safety and the optimization of combining these techniques. We have many options for acne scar treatments, but I found that this technique achieved maximum results. I used Englow. Before the injecting, I started to draw a line approximately 1 to 2 centimeters from the lateral canthus down to the jawline. Then I draw a second line from a corner of the mouth toward target. From this entry point, we will cover our essential area comprehensively. I injected Novia Hydro Deluxe in the subdermal plane with cannula 25G, 30 millimeters long. My approach, as you can see, was the fanning technique, delivering small, controlled retrograde injection. Right, for optimum results. For some acne scar, I adapted the subcision technique to breaking the fibrous band underneath the scar tissue. During the injection, it's not open. During the injection, you might hear some click or popping sound, signifying the breaking of the fibrous band that tatter the scar tissues. Here are the results from the first case. She was 43 years old, and she was my very, very first case. I used Novia Hydro Deluxe, 1 syringe on each cheek. She had 2 treatments, and each time her acne scars and her skin had improved. This is her left cheek. And here is a comparison of before and after. Then I combined laser me with 25 June 2.4 millimeters for both her cheeks. And here is the final results. As you can see, she had improved after 7 months. With Contificare, her lowering scars, her ice pick scars, and her box scar became less apparent. Laser Me is a non-ablative fractional laser. It works by inducing selective injuries in the dermis while preserving the overlying epidermis. Laser Me's wavelength is 1470 nanometers. This wavelength is absorbed by water to create a thermal effect in the dermis. Then collagen production is stimulated. In the next 3 cases, I decided to apply only Laser Me on the left cheek and combine both Laser Me and Hydro Deluxe on the right cheek. Here are the final results for both skin treatment or single treatment with laser me and the combined treatment with laser me and Hydro Deluxe. With Quantificare, we can see standard improvement with laser me. However, we see more profound result for the combined treatments. In this case, I repeat the same procedures. I apply the single procedure on the left cheek and the combined procedures on the right cheek. Here are the results. Similar to previous case, on the combined procedures, she had more improved. Let's focus on the acne scar. On the right cheek, they are visibly smaller. The light is to right. Okay. Again, in case number 4, I apply the same idea with the single and the combined treatments, and it had similar impact. For this case, I calculated each scar to compare the results, and I found the data, and I found that the data shows the combined procedure achieve better outcome than the single procedure. As I gather more data, I will continue to share more insight. So we can enhance the procedure to achieve maximum results. This can improve your practice. Thank you. I don't know how to say thank you in other language. Domo arigato and terima kasih. Any language? Gracias.
Gracias.
Gracias. And where are you from?
Mongolia.
Mongolia.
Yeah.
Wow.
Bairsa.
Baisa. And how to say hello?
Sambeno.
Sanbeno. Wow. Good to see everyone, right? So I think we're all good. Yeah. All right. Any more questions about Safiro, the stimulate that Dr. Ricardo used, and also the Hydro Deluxe with laser me?
I want to ask you, doctor, have you ever tried a stimulate in some of your acne scar patients?
No, never.
Yeah.
You have, right?
Yeah, I did it, but I think that is also great for the rolling scars because when you put this product under the scar, you create this virtual space and there's gonna be a production of new collagen and the stimulate is gonna be able to break the organized collagen structure that is under the scar. So the thing that I've been noticing is that obviously I'm always combining technologies, but if I just perform a stimulate and wait for like around 4 to 6 months and then start performing the other technologies, the result is really good for actually more for rolling scars. Well, ice picks are a challenge now, but Hydro Deluxe is better for me in ice picks, in the ice
What
picks
do you
one.
use with the cannula?
I use a cannula and I try to do like this subcision. Also, the thing that you were saying, we can hear this sound on the tissue, and the results are really good. Are really good. I think that this is important because most of the patients with acne scars also go to collagen biostimulators to look for an improvement on the skin. But when we produce a lot of collagen in just a short period of time, we can inclusively even worse the symptoms of a patient. So it's much better to organize the tissue, to let everything like perfect and balanced, and then wait to perform these other technologies.
I never use the stimulate, but these two fillers, if anyone never used Novia, it have some similar ingredients that's almost the same, which is calcium hydroxyapatite. But in stimulate, have 1% of calcium hydroxyapatite, but in hydrodeluxe have 0.01% calcium hydroxyapatite.
And stimuli is going to stay in the tissue for around
More.
1 year or more,
Right.
1 year and a half.
Longer.
So that's the good thing with the stimuli. We are going to have a long-lasting improvement of the
Right.
quality of the skin.
Right.
Any question, doctor?
Good morning, I'm Dr. James from Bangkok, Thailand. I just want to pose the question to you. Since there are, a myriad of options available regarding the filler treatment in the aesthetic practice, right? Is there any particular indication or therapeutic indication that you would consider, pegylated filler firsthand at your treatment options as we're trying to maximize the safety, and the efficacy at the same time? Since we know that a lot of, fillers in the aesthetic practice, they can like perform some kind of, like satisfactory results in terms of, volumization, contouring, everything. But the unique thing about pegylated filler, I think, is about, like safety and a lot of complications that would come up after when we use the, BDD-based filler. So is there any cases that you would like to propose, the pegylated filler firsthand?
Yeah, well, also, I think safety is something that we are always looking for in our treatments, but we can take advantage of that in some of the dermatological conditions of our patients. For example, acne, rosacea, hyperpigmentation. And that's something that I've been seeing in all my patients there. If I start working in a tissue, reducing the inflammatory effect, also photoaging is a pro-inflammatory response in the skin. If we reduce inflammation, we are always gonna improve quality and health of the tissue. So most of the patients are always arriving to our clinical practice not looking for a fold or for a wrinkle. They are looking to look better. And I think now we know that restoring health of the tissue is going to be the key and the future in aesthetic medicine. If we restore health, we're going to get more. The only way to restore that is not producing any more damage. So here, when we are reducing inflammation, it could be the key, not just for this kind of condition, but also the symptoms of some autoimmune conditions too. So there must be a lot of studies right now going through this portfolio of pegylated fillers. We are waiting for the results, but the good thing here is that most of this evidence has been produce and generate for the own doctors that are starting to work with the fillers, to work with the devices. We're starting to see in our own patients improvement in some things that we were not expecting. So that's why there's like a wave of new articles day by day producing in about pegylated fillers that are really interesting, and all of this information is going to help us to understand more how we can perform and achieve this facial rejuvenation, but also this health improvement on the tissue of the patient.
Do you have any, like, on your personal experiences, you have cases in, like, autoimmune SLE or psoriasis patients?
Well, not yet. Not yet. I can't say anything about that. It's off label. No, but actually, I know some of my colleagues that are working also with Hydrodeluxe. But for me, it will be better to have PEG under the tissue because we can improve this anti-inflammatory effect and in most conditions. You know that autoimmune diseases are really tricky, but the problem is when this patient is asking for something and you're not gonna say, well, let's stop treatments. There are some points in when you are not allowed to perform anything. Also, we have the right to tell to the patient you have a condition that is gonna get worse with the time or something. You have to explain to the patient that. But also we can give some treatments. If you ask to me if I will perform a filler in a patient with autoimmune disease, I will say no. I will say maybe Nuvia will be the best option. Obviously, it's off-label. It's not something that the lab will say, but I'm pretty sure that we all know that there are some points in where we are treating patients thinking that they are completely perfect, healthy, but they are going with an underlying condition that we have no idea, and we don't want complications. So that's why these patients will get an improvement on their tissue when we are treating with Novia.
That's great. And Dr. Joe, so I've been practicing, the combination of laser treatment, laser, and also the combination of hydrodilux. One of the things that's found to be very captivating and fascinating result is in terms of skin, like complexion, pigmentation improvement, like skin brightness, which is very appreciated by most of the, skin color patients like us in the Asian countries. Did you find anything like this in your practice, and how would you elaborate why, the combination of hydrodilux or laser may improve the pigmentation in those cases?
Right, of course, because hydrodilux is the non-cross-linked HA, right? And it has the glycine and alpolline together with the calcium hydroxyapatites. As I told you, that it's not only improves your moisture retention, but it's also stimulates your own epidermal differentiations. Whenever you have more strengthened in the epidermal differentiation, it means in basal layer, you have the melanocyte, right? When the strengthening of the epidermal differentiation is weak, that means you're getting older. So the differentiation is longer. That affects melanocyte. So the dendrite is shorter, and sometimes it can migrate to the upper layer of the epidermis, to the stratum, such as stratum basal or spinulosa. So you can see, that's why when we're getting older, we can see like we have more darker skin and some solar lentigens and some any other freckles that look you old, right? So come back to the hydrodilux. When we injected hydrodilux, we can improve both moisture retentions or the hydration together with the epidermal differentiations, right? But for me, for the melasma or any hyperpigmentation, I always aware to do the laser me on the melasma or on the pigmentation itself, right? I always keep first and inject hydrodilux for full of her face, for all over her cheek first, and then I apply the laser me on the part and skip all the pigmentation areas. And let's see and wait and see for 1 month, 2 months first. If that area is improved, it means you have more healthy skin. So, and on that time you can do combine, right, with the laser me, yes.
There's also in Latin America, as we are a combination of different skin colors and phototypes. Some doctors are using for melasma protocol first with stimulate and then laser me. I'm something like a fan of stimulate,
Right.
but I love it. I love it because as we are using right now, for example, in melasma, tranexamic acid, would it much better to have something that's gonna be in this way to produce less inflammation, but spend more time under the tissue? It's like a prolonged release drug that is gonna be inside the skin, producing less inflammation. And we all know that in melasma, this is an important factor. So that's why doctors are trying to use it. The problem here is that as is a reticulated fillers, we must combine hydrodilux with a stimulant because there are some areas in where we are not gonna be allowed to work with the stimulate because of the heaviness of the product. So maybe perhaps in the jaw area, we are not gonna be injecting a stimulant, but we can choose hydrodilux, and the combination of therapies will help us to improve all the layers of the skin.
For the rolling scars that you mentioned, or some melasma, which layer you injected the stimulate with the cannula?
Deep dermis will be
Deep
good.
dermis as well?
It's not that easy, and we know that there are some patients in where we almost broke the cannula, but we must try. And in these areas, the improvement is really good. Also, is like you can feel when you when the patient arrived to the next session 6 months later, that working with the cannula is gonna be easier. So we know that this collagen is different. We know that this tissue is getting
Right.
better, and that this fibrotic process is getting lower and lower. So it's getting better.
Do you have like experience, using the stimulate? There is another version is stimulate man, right? Which is higher what's that? SA concentration,
SA
26 versus 28. I
Exactly.
think it's coming up to Thailand soon. Do you have any experiences on that? And you see the difference between the conventional and the more concentrated one?
Why I use one or what I use another one? I missed the question.
I think
The difference. Yeah. Yeah. Well, actually, when Nubia arrives to Colombia, the first product that we start selling, and I say we as I'm the owner of the company, but I'm not, that the company started to sell there, and it was really fast, was a stimulant man, because a little goes a long way. So the thing with this syringe is that you can use it in different kind of patients. You can improve the results in patients with a thicker skin, maybe more heavy face. So you can use a stimulant man to enhance the result to try to improve the profile of a patient, and also for men. But you can use it for women, for men, and as we are Latins and we all have this skin that is thicker, we saw a lot of good results with the stimulant man. For me, a stimulant is more easy to go, it's more easy to apply. I prefer to apply a stimulant in a lot of areas, even the nasolabial fold, the marioline lines, when I want to improve the quality of the skin. And I let a stimulant man to the perfilation, the profile of the patient face to make it more sharp and more defined.
I think it's time's out. The staff try to stop us. I think we're all good today, and I hope everyone get a lot of good information from us. Right. Thank you.
And thank you very
This
much,
is
Dr.
Karen.
Joe, Dr. Ricardo.
Thank you so much.
Thank you. If you are interested in our products and want to find out more, please come visit our booth, booth
Right.
number 3 on level 2. It's right outside room 2. See you there. Thank you very much for everyone.
Thank you.
Thank
สวัส
you.
ดีครับ